So, good afternoon, good evening, from wherever you're coming from. Thanks once more. As I mentioned at the start, I am HYSANTINE ARREA, a pharmacist supply chain professional working currently in Côte d'Ivoire, Abidjan. I am pleased to facilitate this expert session. I know we're working with experts, so I'm pleased to facilitate the expert session in collaboration with Professor Andy. Professor Andy, it's good to have you. Thanks a lot for having me. So we'll dive straight into what we have to do today. So it's an expert session on module 5, inventory management. So we have our agenda. We'll start with an introduction, housekeeping announcements. The first part of the presentation is going to be based on basics of inventory management. Then we are going to take a break to do the first session, Q&A session. Then we'll do the second half, which will be key factors on inventory management, and the second Q&A session, which is going to be slightly longer. Okay, so this is just a brief biodata of me, so we could skip that, given it was programmed for 90 minutes, but we'll try to wrap up in 60.
Okay, Hysan, perhaps go to full screen on your slides. Go to slideshow. That makes it a little bit clearer to see. Yep.
Okay.
That's better. Thank you.
Oh, thank you, Professor Andy. So for housekeeping rules, we have the following. Kindly mute your mic and turn off your video. Please ask questions using the chat box and raising your hand. You may also ask questions in the chat box at any time. When and only when you're invited to speak, please remember to unmute yourself and turn on your video. The webinar recordings will be available at the Empower School channels, and the slide deck is going to be shared with all participants. Before we start, please, all those who are part of this session, will be nice to have you to send your name and where you are joining in from in the chat box. Thank you. So our objective here is, the main objective of this webinar is to give you a chance to ask any questions to be answered by an expert. We're graced to have Professor Andy with us and myself. In this course, the speaker will also summarize the module, then invite questions, and finally indicate how you can self-measure your progress and skills achievement as you move through the course. So I want to start off with this. Information is the engine that drives the logistics cycle. Information is very crucial. It's very crucial for a proper functioning logistics cycle, for a logistics system to work smoothly. That's why we always say the logistics management information system is the heart of the logistics system. So for the introduction, we presented you the logistics cycle. And as we know, the pillars of the logistics cycle, we have seven customers or 7 clients. We have product selection, we have quantification and procurement, and we have inventory management, where we're going to focus on today. However, we have to know that inventory management is not standalone. As you can see, it's in a circle. So all of these, all what we do at the end of the day is to be able to serve our customers, is to be able to serve patients, to be able to ensure the 6 rights, as we all know in logistics. I will notice the quality monitoring at every step. That tells us that our services do not only have to be of quality, but our products as well have to be of quality. But we should always remember inventory management is no standalone. It is interconnected with the other aspects in the logistics cycle. So inventory management for pharmaceutical supply sounds quite easy, right? All that has to be done is to order, receive, store, issue, then reorder a limited list of items. This seems relatively easy, but it is very durable, because the private sector has proven that it is very durable. However, the public health settings in many low-income countries it's been hard for this to be implemented in public settings in many low-income countries. And this leads to wastage of financial resources which are not really available in the first place, shortages of essential medicines, wastage due to expiration and decline in the quality of the patient care. And as I said at the beginning, our optimal goal is to be able to meet the patient, ensure the 6 rights in logistics. So there's this notion that like the current project I'm working on, it was actually, we leverage private expertise, Coca-Cola, because when they noticed that Coca-Cola was found in remote villages constantly, meanwhile, basic life-saving medicines were absent. So using the expertise of Coca-Cola, that's what we're trying to do currently now in Abidjan, to ensure that the basic life-saving medicines are consistently available to ensure uninterrupted supply of these health products. An effective inventory management will ensure a reliable availability, low cost, and assured supply. So that's it for the introduction. We're going to dive into the first phase of the presentation. Here we're talking about basics on inventory management. And we'll start off with achieving a balance. So fundamentally, inventory management is all about achieving a balance. As larger quantities are ordered, unit buy prices reduce. That's the bulk buying and not the holding costs. So let's concentrate on the graph we have on the table. So we have the y-axis and the x-axis. We have the order quantity on the x-axis and the costs on the y-axis. We can see the curve, the green curve, which represents the cost, the acquisition cost. And we notice here that when the order quantity increases, the cost reduces. On the other hand, we notice that the holding cost, however, when the order quantity increases, the holding cost increases as well. So in inventory management, we have to find a balance. We have to find a balance. We have to be able to find the economic ordering quantity, which can also be called the optimal order quantity. By doing that, we're going to use the minimum total cost. And that should always be our goal, to be able to use the minimum total cost to get the best service we can get. So I would love to ask for the participants present for this expert session, how many of you have ever determined the best ordering size? You can leave a comment in the chat box. Why is this a problem? We started off by saying the problem is with information. There's no data. The cost of warehouse is not known. More often than not, we have our ministries, the Ministry of Health that puts at our disposal maybe a warehouse. We don't know what happens to electricity, water bills. We don't know the exact salaries of the workers that work in these warehouses. There's the insurance that we really don't know what the exact cost of the insurance that we pay and all. But all of this is going to affect the holding cost. So the main problem here is the basic cost is not known. A vast majority of public health supply chain they have no idea what the holding costs are. Most have never ever tried to calculate it. So if you have ever tried to calculate it in your country, it would be nice for us to know. You can drop it in the chat box, and it would be nice for you to share your experiences with us. Similarly, procurement units have no idea how the unit prices relate to the volume. As we mentioned earlier, when the other quantities increases, the volume, the cost reduces. They could do nothing about it since they are looked into a fixed quantity tender system. Most public sector medical commodity supply system perform poorly due to lack of knowledge on inventory management, ineffective management, and chronic underfunding. To achieve a balance in inventory management, we have to have clear policies with realistic targets. So clear policies with realistic targets must be set. We need adequate funding. Adequate funding must be provided. Key parameters must be measured, and the calculations costs must be done using established costs. Talking of that, we're going to move now forward to the items we need to hold in stock. There are a variety of items on our essential medicines list. Do we hold all those items in stock? Which items do we hold in stock, and why do we hold those items in stock? So the key reason of holding items in stock, first of all, is to ensure availability. So forecast demand is hardly ever accurate. Thus, proper inventory allows the absorption of fluctuations. As we say, a forecast is really just an estimation, so it's hardly ever accurate. Please, could you mute your mic? Thank you. So another reason for holding stock is to reduce the unit cost. So ordering in bulk from a supplier reduces the delivery cost and the overall acquisition cost. To avoid shortage, in the case of emergency, we all know that in the case of emergency, unit cost is likely to be more expensive. And also stockouts lead to the loss of revenues as the client or patient will go elsewhere. Minimize ordering costs, as purchasing costs increase when small quantities are ordered. Please, could you mute your mics? Thank you. Minimize transport costs. So those are the reasons for holding costs. But now, what are the disadvantages for holding costs? We have a substantial capital that can be tied up to the inventory and thus unavailable for other purposes. Where the inventory becomes large and the costs of personal utilities, storage facilities, insurance and storage, and other holding costs will increase. We have high inventory levels. High inventory levels are likely to lead to loss due to spoilage, because if the inventory levels are high and, for example, my storage conditions are not good enough, it's going to lead to spoilage of the products. Okay, there's also a tendency, if I'm overstocked, there's also a tendency of expiry, and we'll not also forget the theft, which is a possibility. So we also like to raise up that if a year of carrying costs in the private sector, we year of carrying costs, bear in mind that is the same thing as the holding costs, but the private sector will mostly talk about carrying costs, and those are the various costs associated with the carrying costs. So there's a need for a cost-benefit balance. The adverse effects of a high stock level compel managers to practice a proper inventory management by balancing the stock holding costs, the ordering costs, and the stockout costs. We'll know, as we know, stockout has a cost. It is expensive to have. The cost of having medicines is huge, but the cost of not having medicines is massive. As we all know, the cost of having, for example, an HIV medicines can be about $10, but the cost of having a stockout, having a patient die due to a stockout can be approximately $25,000. So there's a cost associated with a stockout. Most public sector pharmaceuticals try to stock all items on their essential medicine lists with no differentiation. So there's lack of discrimination. This leads to an accumulation of slow-moving stock and excess capital stock, which is tied up. Trying to stock so many items overwhelms the already poorly resourced operations. So what can we do to be able to know which stocking unit, which items to keep in stock and which not to? We could use the ABC and the Venn system in deciding the stock to be held. What's the Venn system? It's a method of categorizing stock as vital, essential, and non-essential. The Venn analysis is usually used when funds are insufficient to purchase all items. So as vital, it goes without saying, the vital medicine should normally be regular stock items, while the non-essential medicines, the N, might need further consideration before being stocked. If we go now to the ABC analysis, it's a good tool for reviewing stock movement. It categorizes items by volume and the value of consumption during a specific period of time. So we have class A, class B, and class C. Class A, these are 10 to 20% of items, which represent 75 to 80% of our expenditure. So these are mostly high volume and fast moving medicines. Class B, we have 10 to 20% of items and 15 to 20%, which corresponds to 15 to 20% of the expenditure. And for class C, we will have most of the items, about 60% or more of the items in class C, but these items might not be needed in the stock. So the key takeaway for able to find a balance is that inventory has a real cost, and it's called the holding cost or the carrying cost. Procurement has a real cost, and it's called the acquisition cost. How you undertake procurement will affect your inventory cost, because inventory management and procurement are interlinked. As I said at the start of this presentation, inventory management is no standalone. How you undertake inventory management will also affect your procurement costs, because if I decide on the number of products, on the products to buy, the quantities to buy, it's interlinked with how I'm going to stock them. I have to know that, okay, if this is coming, I'm able to stock what is coming. I have the right resources to stock it properly, to manage it properly, and to distribute them properly. So in procurement, inventory management and procurement are interlinked. Always remember that. And always consider that the cost of holding and the cost of purchasing, always consider the cost of holding and the cost of purchasing when deciding to buy items or to keep items in stock. So now we're going to go to the concept of, the optimal stock. That's the service level. In most the public sector pharmaceutical, as low income public sector pharmaceutical supply systems, we do not even have a target service level. And as Lord Kevin said, if you cannot measure it, you cannot improve it. If I don't know where I am at, there's no way I'm going to do better. So a key factor in deciding the optimal stock level in this is the service level, since it has a major influence on both the working stock and the safety stock. The service level, in its most simplest terms, it is just the number of items issued divided by the number of items required times 100%. We might have a tendency to want to take to put the service level at 95%. But as we mentioned earlier, it has a direct impact on the working stock and the safety stock. More safety stock means more increase the holding cost. Is that what we're ready for? So we must be able to identify what best works for us, because in logistics, it's never one size fits all. So what might work for A is not necessarily what will work for B. What might work on at the central level is not necessarily what is going to work at the district level or at the level of health facilities. So it's never one size fits all. We have to know what works and be able to calculate. So again, I would love to ask all the participants, have you ever calculated the service level at in your various institutions? If yes, can you let us know your service levels at the various levels of the health pyramid in the chat box? The service levels can be achieved in practice. The service level is directly determined by the average inventory levels and the average level of safety stock held by the supply source. As we can see on the graph, when the service stock increases, the safety stock quantity also increases. And we know that when the safety stock quantity increases, will also lead to an increase in our holding costs. So we have to know what best works for us, and of course, what best works for the patients we're going to be, or the customers we're going to be serving. So methods of determining the safety stock. All safety stock calculations consider two major factors: the average monthly consumption, or the average consumption, and the average lead time. These are the two things you should bear in mind when trying to determine the safety stock. So to calculate the safety stock is actually the lead time times the average consumption. But now the average consumption, there are months where it's not always ideal, because normally we know the average monthly consumption, you take maybe 3 months or 6 months in some cases, it's divided by the number of months. But then in the case of stockhouse, what do? You have to apply the adjusted average monthly consumption, where you're going to deduct the days of stockout to actually get the real consumption. So our takeaway for the service level is that service levels have not always been considered in a rational and realistic way in the public sector, and we should try, we're part of this session, we're part of the Empower course, there should be a difference after doing the course, after going back, we should be able to see that impact. When we practice it, doing the course is one thing, but going to practice what you've learned is another thing. Implementing what you've learned, it brings so much fulfillment. So if we're not doing that at our various institutions, maybe we should try to see how it could be implemented. And it's necessary to bring to the understanding that there's a relationship between the service level, the safety stock, and the full cost impact of holding unnecessarily high level of safety stock. Then the different service level can be applied at different categories. As I mentioned earlier, we do not have to have the same service level at all the levels. For example, at the central level, we can have a different service level. At the level of the health facilities, we can have a different service level. At the level of the region or the district in some countries, we can have a different service level. But what we want to achieve is that we want to serve patients, we want to serve our clients. And safety stock, when there's enough safety stock, there's a lower probability of us having a stock out. And giving patients or clients at the last mile, at the level of health facilities, we want to have a reasonable amount of safety stock at the level of health facilities. That said, we're done with the first half of the presentation, and we're going to kick off with the first session, the first Q&A session.
Okay, we don't have any questions in the chat box, so if you'd like to raise the hand, please, if you use the little icon on the screen to raise your hand, and then you can go ahead, unmute and speak your question, or type them into the chat box. Okay, first question for you. Has any of your countries got an established service level? Do you have an established service level? You can raise your hand or just type the answer in the chat box, please. Hey, we've got 31 countries today and no one has a service level. Surely someone has an established service level for their system. Okay, does any country know what their holding cost is? You can just raise your hand or type in the chat box, please. Marina, you're unmuted. Do you want to speak? No one knows what their holding cost is. Oh dear. HYSANTINE, I think we have a difficult one here. We have no data at all.
We have no data, and that's the major problem with the public sector. Data.
Okay, so let's just think. Often the Minister of Health will say, I want a 100% service level. You must have every item on the essential mist in stock 100% of the time. To do that, you would need a service level 4 times more than your average monthly consumption. It's impossible. No one has a warehouse big enough. No one has enough money to pay the holding cost. So we have to balance the service level. What can we do? Can we supply 90% of the items from stock? That would be a 90% service level. Yeah. And that's the kind of balance we're trying to get you to think about. To make that balance, you need some data. You need to know what your holding cost is, what your service level is, and what your acquisition cost is. Okay, Lucia is saying she wants to follow up in Tanzania. I know Tanzania has the data because I have been there and measured it, so it should be available. Okay. Any other country know what their service level and holding cost is? So the idea is we have to try and get this balance. We have to try and explain to people, like the minister, who will always say, I want 100% service level. What is practical? What is the cost balance for my country? As we explained, you don't have to have the same service level on every item and at every level. So for the vital items, the V items, people will die if they don't get them. So I want a 100% service level for those items. For paracetamol, no one is going to die if you don't have it. It's not convenient, but nobody will die. I don't need a 100% service level for paracetamol. I can accept perhaps an 85% service level. So get the idea of bringing the balance to this according to the VEN classification and the ABC classification. Okay, if anybody wants to speak, please raise your hand and we'll unmute you. And no hands, or type a question in the chat box. Or if you know what your levels are, any data for your country, then please enter it. Well, it looks like our first slide was far too accurate, HYSANTINE, yeah? There is no data in the public sector.
Yeah, there's no data in the public sector. So we have to try, we don't have to try, we have to do it. Given we have done this course, we're part of it, we contribute to our public sector. So maybe our challenge now, or the plus we're going to do, is to ensure that we put this in place. It's going to be an added benefit for us and for the country as a whole. To ensure we put this in place. Vivian, yes, my contact is going to be shared. It's going to be shared for further interactions.
Okay, then I suggest we go on and we have a longer question and answer session at the end. Maybe we'll get more questions at the end.
Okay, thanks, Professor Andy. So we're going to continue with So we're going to continue with the next part of the presentation. So if you still had questions for the first session, just enter them into the chat box, and at the end of it we have a longer session for Q&A, and we're going to attend to your questions. So now we're going to be talking about key factors of inventory management. So we're going to start off with some key inventory control terms. Inventory control system, the following key terms are extremely important. So the max min inventory control system, which is designed to ensure that quantities in stock fall within an established range. We have the max level which will correspond to the max quantity we should have in stock. The min level, which will correspond to the min quantity which you have in stock. So yeah, we love the various countries present. If you can tell us the max and the min level you have at their various levels of the health pyramid, be it at the central level, be it at the regional or district level. But there's some countries where products leave the central level directly to the district level. Be it at the regional or district level, be it at the level of health facilities. If you could tell us your level, your max and your min, and more importantly, how you got to that, is going to be interesting. You can put that in the chat box. So we have the review period. This is actually the routine interval of time between the assessment of stock levels to determine if additional stock is needed. This term is also used, it's also called the order interval or resupply interval. But the review period is preferred because in some max-min system, a review does not always result in an order being placed, and we'll see that later. The review period stock is the quantity of stock dispensed during the review period. We have the safety stock level, which is the additional buffer or the reserve stock that is kept on hand to protect against stockouts. We're going to see a graph later on to see when the order does not when the order is not received in time, how it can dip into a safety stock. So the safety stock is actually to prevent us from having a stock out. And the safety stock is expressed in the number of months of supply, which can also be converted into a quantity. The lead time stock level, this is the level of stock used between the time a new stock is ordered and when it is received and available for use. So it can be received, it's not available for use, we have not gotten to the end of it. It has to be received, available for use. If it's at the level, if it has gotten to the level, if it's a central warehouse, it should be received, maybe entered into my stock or bin cards, properly arranged on the shelf, so that in case a patient comes, I can serve a patient or serve a region. The lead stock, the lead time stock level is expressed in the number of months as well as the quantity, as well as the quantity. The emergency order points. This is the level of stock that triggers an emergency order. It can be reached at any point during the review period. The emergency order point must be lower than the mean. Do you have an emergency order point in your country? If yes, could you enter in the chat box so we all share and know the emergency order points in your various countries? So there are three types of the min max control system that are applicable to health commodity logistics system. There's the forced ordering, or you can also call it a scheduled ordering. There's a continuous review, and there's the standard review. The continuous review, the standard review is actually a mix of the forced ordering and the continuous ordering. So for the forced ordering, the trigger for ordering is the end of the review period. So, and most systems use this forced ordering. So the forced ordering, what happens? We just bring our stock to the max. We don't wait for it to get to the mean. At the end of the review period, end of every review period, all the stocks, all the items that are below the maximum level, we bring all of them up to the maximum level. For continuous review period, this one is a little strenuous. For continuous review period, whenever we have a stock that gets to the mean, we order that item. So that's why it's really continuous, because you might have a stock that gets to the mean today, you have to order the item. Tomorrow you might have another stock that gets just, so the cycle is really continuous. So whenever an item gets to the minimum level, you have to order the item. So for the standard system, it's a mix of the two. So a mixture of the forced ordering system and the continuous review system. So the trigger for ordering here is the end of the review period and all commodities that are at the minimum level. So for the standard ordering system, you look at every product. So it's not like the first, where whether my product is at the minimum level or not. So far as my product, the item is not at the maximum level, I'm going to order to bring it to the maximum level. The continuous review, whenever my product is at the minimum level, I order that particular item. For the standard, it's a mixture of the two. I order at the end of my review period for the commodities, for all the commodities that are in the minimum level. So it would be nice to know in the chat box which system is used in your country. Is it the forced ordering system or the scheduled ordering system? Is it a continuous review system, or is it the standard system? So this shows us an ideal inventory situation. You see that I place my order maybe at the mean, or depending on which system I'm using, before I get into my safety stock, my order is being delivered and it takes me back up to my max, and it continues like that. However, we do not live in an ideal situation. We live in a real life situation. And for a real life situation, deliveries can be late, consumption might vary, because a consumption is not consumption. Please, can you mute your mic? Thank you. So consumptions vary. So my average monthly consumption might not always reflect the exact consumption that is going to be consumed the previous month. There might be fluctuations in my consumption. So all of that can, with late deliveries, can have an impact on the stock, on the safety stock, can make me dip into my safety stock. In the ideal situation, I will not want to dip into my safety stock. So we must seek for practical inventory control models, which can work in the real world and meet the needs of public sector, which often has poor quality data, incomplete data, as we just saw, or sometimes no data at all. Chronically under-resourced and under-financed operations, very low supply chain awareness amongst decision makers and staff within the system. So what approaches do I use to reorder? There are two main approaches that I could use to reorder. There's the minimum maximum stock level approach. There's the consumption-based reordering, this formula. But then to reorder, I have to know what I need, and what quantities I need. So it's going to come down to, as we spoke in the beginning, procurement and inventory management is interlinked. Because what for the quantities I procure is going to affect my inventory management, and inventory management also affects the quantities I procure. Talking of that, I know in most countries, especially in developing countries, we have the yearly, the annual tenders. But then we have to be able to, as I said in the beginning, it's never one size fits all. We have to know what works best for you. Annual tenders that are going to order stock for 1 whole year. Do I have the capacity to manage that stock? 1. So do I have the storage space to keep that stock? Bearing in mind that if the stock is not properly kept, if the stock is not properly stored, I will have wastage. Am I ready to incur that loss? So those are the little things you have to look at when we're ordering. But as I mentioned, there are two main approaches: the min and max and the consumption-based formulas. For the min and max, a theoretical maximum stock for each item provides sufficient. The stock provides the stock lasts from one order to the next. The minimum level to reorder. So at times, depending on what system you're using, what control system you're using, the minimum stock might be the stock where you're going to reorder your items if you're using the continuous system or the standard system. So for safety stock might be included in the minimum level, but there are systems where there's an additional quantity might be assigned to protect against variation in demand and supply performance. So once min-max levels have been set, the operator is not required to undertake any complex calculations. Okay, it's true that we're going to tell you how that is calculated. I think you have that in your course, how it's calculated, but in most countries, I think we have it already set. But now as a professional, what is set, does it work for you? If it's not working for you, does it work for the country? If it's not working for the country, what are you doing based on the knowledge you have acquired? What are you doing to get those max and min revised? For a perpetual review, if a perpetual review is being used, perpetual review is the same thing as continuous review control system. As soon as the min is reached, and explained this already, you have to reorder. But in the case of a scheduled ordering system, which is the same as this forced ordering system, every time an order is due, they'll just order the quantities, that's take it back to the maximum level. And this is what is mostly used at treatment site levels because it's easy to operate. So to calculate the stock, the minimum stock, the formula is the lead time times the average consumption plus the safety stock. And for the maximum stock is the minimum stock plus the procurement period times the average monthly consumption, the average consumption. So that's said about the max and min formulas. We're going to go to the consumption-based reordering formula. So yeah, whether it's a push system or a pull system where the quantities to be issued is calculated, a pull system where the quantity to order is calculated. So either the quantity to issue in the push system or the quantity to order in the pull system, irrespective of which system you're in, the push or the pull, the formula for the consumption-based reordering is the same. So it's the maximum stock minus the stock on hand. How can the maximum stock be determined? The maximum stock is simply the average monthly consumption multiplied by the months of stock you've set for your maximum stock. There are people who have 4 months, that people who have 6 months. If you could tell us in the chat box what you have in your country and how that works for you, is going to be, it would be nice to hear from you. That said, we're done with the second half of the presentation, and we're going to move over to question and answer. Thank you.
Okay, we don't have much in the chat box, but we do have from Lesotho, Kenso Dumelara. The service level in Lesotho is 87%.
Oh, nice.
And that's a good balance. That's a good figure. Point about the service level is it relates to the safety stock, the buffer stock.
Yes.
So if I increase the service level by just a few percent, going from 87% to 90% would double my safety stock, double, just to go 3%. Going from 94% to 96%, I'm going to add another 100% safety stock. So we have to be realistic in setting safety stocks and service levels because they're interconnected. Right. Okay. We have a hand up from Patrick Kapusala. Would you like to unmute and ask a question, please?
Thank you so much for giving me this opportunity to ask a question. I would like to understand how do you set the emergency order point, bearing in mind that it has been emphasized that it should be below the minimum order point.
Right.
Yeah, thank you.
So normally we would set the minimum order point at the lead time plus a safety factor. Yeah. The emergency order point we would set usually at a lead time for an express delivery. Let's say normally you would come by land or sea. Your lead time might be 3 to 6 months. For an emergency, it might come by air. It might take 2 months. So you set the emergency order point according to the emergency lead time. What's the fastest time you could get it there? If it's 2 months, then your emergency order point is 2 months. Hyacinth, is that your opinion as well? Yeah.
Yes, that's my opinion. Thanks a lot, Professor Andy. Yes, that's my opinion. As the professor said, Professor Andy said, the lead time, for example, by air is usually shorter. Maybe he just exaggerated with 2 months. It's even much shorter than 2 months. So based on that, you could set your emergency ordering point.
So the key point for the reorder point, for the emergency reorder point, for everything you're doing there is the lead time. So you have to know your lead time reasonably accurately. Okay, we have a question in the chat box from Marina. Is the minimum stock level always set at each level, central, regional, and district? HYSANTINE, I'll let you take that, please. Yeah.
Okay, thank you, Professor Andy. Yes, it should be set at each level, because the minimum, once you get to your minimum, you know that you're going to, the least mistake you make, I can get into it's on my safety stock, and I don't want that, because as we said, the safety stock, the minimum stock is actually the lead time stock plus the safety stock. So it cannot be the same at every level. For example, in Cameroon, the minimum stock at the central level is 6 months. But then, do we have enough money to always keep 6 months at the central level? Question mark. The minimum stock at the regional level is 3 months. The minimum stock at the level of health facilities in Cameroon, for example, drugs do not go through the district. So from the regional level, it goes directly to the health facilities. The minimum stock at the district, at the level of health facility, is 1 month. So it's always easier, it's always better to set the minimum stock at every level. For example, in Côte d'Ivoire, where I am at the moment, the minimum stock at the level of the district. In Côte d'Ivoire, products do not go to the regional level. They leave the central level and they go to the district, and from the district, they go to health facilities. The minimum stock at health facilities, we have 2 minimum stocks for big hospitals and for smaller health facilities, for smaller service delivery points. The minimum stock is 1 month for the small health facilities and 2 for hospitals. At the district level, the minimum point is 2 and 4. So yes, just to answer that, yes, at each level, it's better if we could set the min and the max. Thank you. Marina, I hope your question was answered.
The next question in the chat box, how to integrate the seasonality factor in a consumption-based supply system?
The seasonality factor.
So we might say we only get malaria during the rainy season. We will have a very high use of anti-malarials in the rainy season, but almost nothing during the dry season. How can I allow for that seasonal variation?
Okay, so that's why we want to calculate your average monthly. I'm going to start and Professor Anti can complete. You want to calculate your average monthly consumption. Use the data as recent as possible. Use the most recent data to calculate your average monthly consumption. You can even go further to calculate the projected monthly consumption, knowing that, okay, normally in this period, we have a projection of maybe 5% that usually adds in my consumption due to maybe malaria, due to the season and all. So you can always add that factor, but it boils down to the average monthly consumption. Once you get your average monthly consumption right, the stock that you're going to order, your reorder, is going to be more or less accurate. Professor Andy, can you add to that?
Yeah, okay. In later modules, we'll talk about advanced inventory systems, and we'll talk about how we adjust for seasonality, particularly around malaria, using statistical analytical techniques. So we give different weights to different months in the average monthly consumption. We don't use a simple average. We use a standard deviation or a least squares progression, and we'll talk about 3 or 4 different analytical techniques using statistical functions. It sounds complicated, but these days the computer does all the work. All you have to do is put the data in, and it will provide a trend analysis for you to allow for seasonality. So it's be aware that there are statistical techniques that can handle this. And these days, they're relatively simple to do on most MIS systems.
Thank you, Professor Andy.
Okay, next question in the chat box. What are the factors based on to calculate a max stock level?
So to calculate the max stock level, you need your minimum stock. You need your minimum stock, and I'll need my minimum stock and the procurement period and the average monthly consumption. So the max stock level is actually the minimum stock plus procurement period. So the procurement period, what's the procurement period? Procurement period is more or less the lead time, but just at the central level. So the procurement period plus the average monthly consumption. Procurement period times the average monthly consumption plus this minimum stock. And to calculate the minimum stock is the lead time times the average monthly consumption plus the safety stock. Professor Andy?
Yeah, exactly right. So it's based on the average monthly consumption and then how long between ordering periods, which we call the procurement time, right? Or the procurement review time. So if you're ordering every 6 months, you will want the maximum stock will be 6 months of the average monthly consumption plus a little bit for safety. So it's based on the average monthly consumption and the procurement period or the procurement frequency. That's how we calculate it. Okay, next question. Using the forced ordering and continuous approaches, does the negative adjustment for health commodities, breakages, expiries, fire, disaster, etc., affect quantities to order and the max min stock level? Do you want me to take that one to start, and then you can perhaps add to it? Right.
Yes.
Okay. Right. So there's a number of ways we allow for this. In its simplest way, which we explain in this module, we apply an adjustment factor, which we call AJ, to the quantities. So we work out the order quantity, and then we add a bit more, which we call the adjustment factor. On the more advanced techniques, we do an analysis, and we use standard deviation, or we use least squares progression, or we use binomial functions, different statistical techniques to do it. But the bottom line is we have some kind of factor that we add in. In most public sector systems, we have no data. So often we have to estimate. In truth, often we have to guess what the adjustment factor is. But as we get more advanced computer systems, as we get MIS, we get data, we can then calculate these adjustment factors and allow for all of these. Statistical techniques, as I mentioned, standard deviation, least squares progression analysis, which will be in later modules. We explain a little bit about those, but it's quite complicated statistical functions. So we only explain how to use them, not the detailed mathematics. And basically, you use them on the MIS system. They do the calculations for you. Hyacinthe, would you like to add anything to that?
No, that's good. I'm good. Miss Pierre was just letting me know that we're running out of time. So, Prof, I don't know if there are more questions. I don't know.
We got one question with a hand up, so we'll take that and we'll make that the last one, shall we?
Okay.
Okay,
sure.
Peter, go ahead, please.
Thank you so much. Thank you so much, Prof, for the good presentation. I have a quite serious issue with the ordering, if I may say, in terms of days out of stock. In the country where I am right now, most of the time you might find that when coming to the point of general drugs, that is essential medicines, most of the time they are out of stock at the central medical stores, and we depend on central medical stores 100% in terms of ordering drugs. So my question would be, what kind of adjustment factor that we may utilize in this so that it can be much appropriate in terms of ordering? Because most of the time when you include days out of stock in your reporting, you may find that it practically doesn't work, because most of the time in terms of 100 items that you are ordering, for example, the service level might actually be something like around 30% or so. So most of the time you'll find yourself being putting adjustments in terms of days out of stock. You do average monthly consumption with adjusted days out of stock or something like that. Can you kindly assist in terms of this? How practical it is to utilize this in the situation where we really have a problem with the shortages of drugs centrally? Thank you.
Dr. Anzi, Professor Anzi, do you want to take that?
Okay, right. So there's a simple formula to include to adjust the average monthly consumption for days out of stock. And you'll see that formula in the module, we put it in there. So we talk about out of stock as OOS, out of stock, yeah? And you'll see the formula based on 30.5, because that's the average number of days in a month, yeah? And that's a relatively simple formula. So that will adjust the average monthly consumption upwards. However, it's a crude adjustment. It's never very good, because you can't ever really know. Also, once you've been out of stock, you get a rebound. So when it comes back into stock, you use a lot more, because people are afraid it will run out again, and then you get distorted average monthly consumptions again. So we adjust using the OOS factor on 30.5 days per month, but we have to be aware it's a crude adjustment. It's better than nothing. It's not very good. That's the overall situation on the out of stock.
Thank you, Prof.
It's not very good news for you, I know.
Yeah.
That's the
He wanted
reality of
more.
how it is.
He wanted more because he mentioned he uses that already, but it does not reflect the reality.
Yeah.
But as
Right,
Prof said,
I'm being prompted to wind up, so we're going to have to end now.
yes. All right. So thanks very much for the session, Prof. I don't know if you have any closing remarks, but thanks everyone for
I think we can
participating in this
say
session.
Good night to everyone. Thank you for joining us. That's all from me.
Okay. All right.
Thank you
Thank
so
you.
much. Thank you so much. Thank you all.